Right axis deviation, often shortened to RAD, is a term that we use to describe a shift in the heart's electrical conduction pathway. Normally, the electrical impulse that causes the heart to beat travels from the top right side of the heart, the SA node, down to the bottom left ventricle. This pathway results in a normal QRS axis between -30 degrees and +90 degrees on an ECG. In cases of RAD, the QRS axis shifts further to the right, usually between the +90 degrees and +180 degrees. While RAD is not a disease itself, it is a sign that there may be something affecting the right side of the heart, especially the right ventricle. RAD usually develops due to changes in the heart size or function of the right ventricle. For example, in people who have chronic lung diseases like pulmonary hypertension, the right ventricle has to work harder to pump blood into the lungs. Over time, this extra workload can lead to right ventricular hypertrophy or thickening of that heart muscle, which causes the electrical signal to move more towards the right side of the chest. This is what leads to the axis deviation seen on the ECG. Other conditions that can cause RAD or right axis deviation, remember that when I say RAD, I mean right axis deviation, I'm just using the abbreviation term, include certain congenital heart defects like pulmonary embolism and some cases of right bundle branch block. Physically, RAD doesn't directly cause these symptoms, but the conditions that lead to RAD often do. Patients may experience shortness of breath, especially when active, as well as fatigue, chest discomfort, or even swelling in the legs and ankles if the right heart is failing. These symptoms come from the heart not being able to pump effectively, which causes that blood to back up in the body and reduces oxygen flow to the tissues. On an ECG, right axis deviation is detected by looking at the QRS complexes in the limb leads, specifically lead 1 and lead AVF. In right axis deviation, lead 1 usually shows a negative QRS. The impulse is moving away from the left arm, and lead AVF shows a positive QRS. The impulse is moving towards the feet. This pattern is what confirms that the axis has shifted to the right. The QRS complex itself usually stays narrow unless there's another problem like a bundle branch block. Unlike dysrhythmias, which change the rate or rhythm of the heart, RAD does not affect how fast or irregular the heart beats. It just changes the direction of the electrical signal waves, or the direction that the electrical signal travels to. It's important to understand that the difference between right axis deviation and actual arrhythmias. So right axis deviation is an axis deviation. It is not a rhythm problem. For example, in arrhythmias like atrial fibrillation or ventricular tachycardia, we see irregular rhythms. We'll see like missing P waves or even widened QRS complexes. But with right axis deviation, the rhythm is usually a normal sinus rhythm, and the only major difference is the direction of that QRS complex in certain leads. This makes ECG interpretation important, especially in the patients with known lung or heart issues. So even though right axis deviation by itself might not cause symptoms, it's a useful clue in diagnosing more serious conditions. For example, someone with new onset right axis deviation and chest pain might have a pulmonary embolism or right-sided heart strain. In people with long-term lung diseases, right axis deviation is more expected. but it still indicates that the heart is under that stress. That's why recognizing right axis deviation early can help us providers look deeper into what's going on with the patient's heart and lungs. Now remember, right axis deviation shows up when the heart's electrical impulses shift towards the right side, usually due to right ventricular enlargement or strain. While it doesn't directly cause symptoms, it can point to a serious underlying issues or cause. Knowing how to spot right axis deviation on an ECG and understanding what it means is super important to help future healthcare professionals identify those problems early and take the right steps to treat them for the patient.